Social determinants of health look at the very basic human needs. So whether that's shelter, food, safety, transportation, and we have found that when those basic needs are not met, the overall health outcomes are going to suffer.
We started out with social workers, and we recognize that social workers are very important to have. Most traditional care management programs are nurses. But when you look at the health outcomes and quality of life, only 20% is clinical care. The other 80% is health behaviors, social and economic status, physical environment. So when we think about that model of 20% as clinical care and 80% as social determinants of health, that's why we decided to start with social workers. It can be someone who they can rely on for not only healthcare needs, but also for that emotional support. It can be someone who makes sure that they have the family support that they need, that they are thinking about their social determinants of health, that they're thinking about, do you have transportation? Do you have the food that you need? Oh, you're not able to work right now because of your health condition. What can we do to get you back to work? They're really thinking of the member from a holistic view and addressing any problem that member needs.
One question I ask members when I go through an assessment with them is, do you have any financial difficulties with being able to afford rent, transportation, childcare, clothing, other aspects of their life that we may not realize are important, because in healthcare we're so focused on, are you having these symptoms? Are you in pain? So by asking that question, it's able to tease out situations where they'll say, because of my medical issue, I'm on some leave, and so I'm not able to get healthy during that leave because I'm worried about paying my rent, or I'm not able to focus on my recovery to get back to work because I'm worried about paying for XYZ. So I think that as social determinants of health, and asking that question can help identify people who could use additional resources so that we can then focus on those more traditional aspects of health.
When I think about the word health, I think it's a more all-encompassing overall well-being of a person. Not just physically, but also mentally, emotionally. I think mental health and physical health pair together, and when somebody has those things kind of managed well, they can truly thrive.